Welcome to our comprehensive lecture on peri-implantitis. In this video, we'll explore the definition, clinical features, diagnosis, causes of implant failure, and management strategies for peri-implantitis. This condition is increasingly relevant as dental implants become more common in restorative dentistry. Understanding peri-implantitis is crucial for both clinicians and patients to ensure the longevity of implants and maintain oral health. Let's begin by defining peri-implantitis and why it matters in dental practice. Peri-implantitis is defined as progressive bone loss around a dental implant, accompanied by inflammation of the surrounding soft tissues. The process typically starts at the coronal portion of the implant, while the more apical part remains osseointegrated. This means the implant is still anchored in the bone, but the upper part is affected by disease. Importantly, clinical mobility of the implant is usually not observed until the later stages, making early detection essential for intervention. Clinically, peri-implantitis presents with several key features. Color changes in the soft tissues and bleeding upon gentle probing are common early signs. As the disease progresses, pocket formation occurs, and radiographs reveal bone destruction. Suppuration, calculus buildup, and swelling may also be observed. Mobility of the implant is a critical indicator used to detect both early and late failures. Recognizing these features helps clinicians diagnose peri-implantitis promptly. Diagnosing peri-implantitis involves a combination of clinical and radiographic assessments. The same clinical parameters used for periodontal conditions are applied to implants, including evaluation of oral hygiene, marginal tissues, and the bone-implant interface. Accurate diagnosis is essential for effective management and prevention of further complications. Probing around implants is a key diagnostic tool. Successful implants typically allow penetration of about 3 to 4 millimeters, with the bone level expected to be roughly 1 millimeter apical to the probe tip. Monitoring probing depth and clinical attachment levels provides valuable information about the health of the implant and surrounding tissues. These measurements help detect early signs of peri-implantitis and guide treatment decisions. Radiographs, especially periapical intraoral images, are essential for evaluating the bone status around implants. These images reveal the extent of bone loss and help monitor changes over time. Radiographic evaluation is a cornerstone of peri-implantitis diagnosis, providing objective evidence of disease progression and guiding clinical management. Microbial monitoring is useful for evaluating the health and microbial composition around dental implants. By analyzing the types and quantities of bacteria present, clinicians can better understand the risk factors and tailor treatment strategies. This approach helps in identifying infections early and preventing further complications. Implant failures can occur as early or late complications. Early failures typically happen soon after insertion, while late failures arise after reconstruction. Understanding the timing and causes of implant failure is crucial for prevention and management. Both types of failures can significantly impact patient outcomes and require prompt intervention. Early implant failures are often due to improper site preparation, bacterial contamination, inadequate mechanical stability, or premature loading. These factors disrupt the initial healing and integration process, leading to failure before the implant can fully osseointegrate. Addressing these causes during the planning and surgical phases is essential for successful outcomes. Late implant failures are usually caused by excessive load or infection, including peri-implant mucositis and peri-implantitis. These complications arise after the implant has been reconstructed and integrated. Managing occlusal forces and maintaining oral hygiene are key to preventing late failures and ensuring long-term implant success. Occlusal therapy involves analyzing the fit and equilibration of the implant to address excessive forces. Proper occlusal adjustment helps distribute forces evenly, reducing the risk of mechanical complications and peri-implantitis. This therapy is a preventive measure that supports the longevity of dental implants. Anti-infective therapy is critical for managing peri-implantitis. Local plaque removal using plastic instruments or pumice, subgingival chlorhexidine irrigation, and systemic antimicrobials for 10 days are recommended. Patient compliance with oral hygiene is essential for the success of these therapies. Conventional steel or ultrasonic instruments are not suitable, as they may damage the implant surface. Soft lasers show promise in the management of peri-implantitis, offering minimally invasive treatment options. Surgical techniques aim to re-osseointegrate the implant, often modified from tooth bone defect procedures. These approaches are used when conventional therapies are insufficient, providing advanced solutions for severe cases. Regular maintenance and recall every 3 months are essential for monitoring implant health. Cumulative interceptive supportive therapy helps detect infections early and prevents progression. These strategies ensure ongoing care and support for patients with dental implants, promoting long-term success. Effective oral hygiene is vital for preventing peri-implantitis. Use soft, rounded bristles, minimally invasive toothpaste, and chlorhexidine for interproximal cleaning with gauze, superfloss, or irrigators. These practices help maintain healthy tissues around implants and reduce the risk of infection. Patient education and compliance are key to successful long-term outcomes.